So we're going to talk about breathing, communication, and touch. We breathe all the time. We breathe in and out. We don't even think about it most of the time. Labor breathing is not like breathing in regular life, nor is breathing on the way to the hospital, being prepped and in surgery, when we may feel anxious and excited or overwhelmed or a bit surreal by the experience. So breathing is really important. And we learned that the early breathing skills, Lamaze, Bradley, and Grantley Dick Reed, were techniques, but they weren't skills. In these handouts and videos, you're going to learn about the 4 ways humans breathe. You're going to explore those for yourself. You're going to find the variations of those 4 ways that keep you the most relaxed. It's really hard to relax when you're in pain. It's a conscious choice. It's counterintuitive. It's essential in labor and in birth that you use breathing effectively. So there are 2 handouts on breathing. One is sustainable, adaptable, adjustable breathing, and the other is directed breathing, which was our ability to use every inhalation, every exhalation to our benefit. That as we inhale, we expand inside our pelvis, and as we exhale, we soften the soft tissue. The communication was part of teamwork. First of all, we had teamwork within ourselves as women, because often we had these thoughts that went through our head like, I hate this, you're never getting near me again, don't touch me. And so we had to have teamwork with ourselves. We can't just react to what happens to and around us at birth. We have to respond to it. So we had to develop ways to talk to ourselves and to use the different parts of our thinking brain. We had to have the ability to communicate verbally and non-verbally with the person who is going to help us. So you'll have lots of skills that work well with the teamwork handout that you got in an earlier lesson. Then we had touch. You often hear men say, I tried to touch her, she flicked my hand off. Women said, don't touch me now. Well, we had to use touch in birth, and women do want to be touched. They want to be touched the right way, the right time, and the right place. And that's what we developed. We use touch not as a way to massage people or just to fill time. It's a way to get us as birthing women to soften inside, and it's a way of communication. The positive and negative voice handout is very important, very early on. How could we miss it? Women were saying, I hate birth, I hate it. Others were saying, it was a highlight experience. For most of us, we really find birth really challenging. Challenges a lot of the emotions that we have. And those are thoughts that we have. A lot of people think women don't think in labor. We are hyper-thinking in labor. So we developed a handout that explains the negative thoughts that we have and how we can use the management part of our brain to use these skills consciously. And really this is a big difference between the message that was given to women, which was be instinctive about birth. We believe that using skills is very conscious. And in fact, when you see videos on YouTube of women who look very calm and serene during birth, they are consciously using skills. This is not instinctive. They can explain it afterwards. I focused on relaxing. I focused on calming my breathing. The difficulty is they don't know how to pass on those skills to others, and we figured out how to do that. Also, how to really work with your breath is one of the videos in this lesson. There's a very short lesson on massage, and there's a video on how to use the touch together.